for the month that I was in hospital, he came and he saw me every day.
That's incredible.
And struck up a romantic relationship with me in hospital. I mean, without meaning to sound dramatic, literally dying of AIDS. And what it taught me was that there is always the possibility of love. That however bad things look like, there's always hope and there's always love.
If for some reason I lost all my memory, what's the first thing you tell me about us?
I think I'd probably tell you what a great relationship we have as doctor and patient, as colleagues, and I guess that the love and mutual respect that's there.
I think I'd be pretty happy if that was the first thing you told me. That's lovely. I think I might get a bit emotional during this if you carry on being that nice.
Yeah. What experience do you believe forged our connection and why?
God, this is where your mind starts going back through everything we've shared and everything we've been through. When I think about some of the various initiatives and endeavours we've been involved with together over the years, is that you've always felt like an ally. You just give me, like you are now, that little smirk. I just know if I'm on the right path, if I get that little nod or that little twerk in your face. Twerk's not the right word, but you know what I mean. Yeah. And that's how I know.
Yeah. I think for me, it was when you took over as lead at the Bloomsbury, and I kind of knew your commitment to the patient reps and the work and the wish and the desire to do it and to keep on doing it and to do it better. That for me was the feeling of yeah, okay, this is going to work. This will be fine. And that's why it was an easy choice to think about having you as my doctor as well. It's like, okay, if you can trust that, if you know that there's no nonsense, no bullshit, just a willingness to work and to do better, that's all you can want in any relationship, I think.
It's true. Describe the first moment you realised you could fully trust me.
Oh. I guess it'll have been the point that I started to ask you about sexual dysfunction and testosterone, because I'm very comfortable with all the conversations about HIV, all of the health-related stuff, but despite the fact that you're an HIV doctor with sexual health knowledge and experience, all those things, there's something about the vulnerability around functioning that is just it's just a difficult one to broach. And so I think that's probably the moment that was it for me, when I'm like, yeah, I need to ask the question, so I'm just going to ask it. Yeah. It's Laura.
It's just me. And then I've done some complicated calculation of your free testosterone level and all that sort of stuff.
Yeah.
I mean, okay, it's different for me, isn't it? Because we have our colleague relationship, we have our doctor-patient relationship. I guess, so for me, it's more about when did I know you fully trusted me, is when you, even though we'd known each other for longer, when you chose to entrust me with, I thought you'll care. I see myself as a navigator, that I'm just helping you steer your own course. And so that's when I knew, I thought of all the people you could choose to see and all that you know already, you've trusted me. So that felt very special.
Yeah.
At what point in your HIV journey did you feel the most vulnerable, and what did it teach you about caring for yourself?
Oh, it would have been right in the... It was just one. Actually, I'm trying to think which point it was. So there was a 2-year period just before I started HIV meds where the KS was in my lungs and I started having attacks and, being admitted to hospital, and then starting chemo. But the point when I started treatment and I got immune reconstitution syndrome with PCP and my chemo had been failing and I'm in hospital and I found out that I was allergic to Septrin, and so I went through anaphylaxis, and so they're like, we can't give you any chemo because we need to sort out the PCP first, but we don't know whether in that month the KS might get to the point that we can't save your lungs anyway, and so do you want to see a chaplain? And so I said yes, and I, despite the fact that I'm not in the least bit religious, and I got this poor chaplain in and I shouted at him and railed against the God that, had watched me for all these years do everything I could to turn my life around, to be the best person I could, to deal with my health as much as I could, and this is what was going to happen to me. And he was fantastic, bless him, on Broderick Ward. And at that point, I was in hospital and I'd met somebody the week before I'd gone in, and at a 12-step meeting, and the guy had arranged to have we'd arranged to have a date on the Monday, and on the Saturday I was admitted into hospital, and so I rang him on the ward phone because it was pre-mobile. I said, look, I'm not going to be able to make it, and explained I was in hospital. He said, oh, you're still free on Monday night then, can I not come in and visit you? And it blew my mind, and he came in, and for the month that I was in hospital, he came and he saw me every day.
That's incredible.
And struck up a romantic relationship with me in hospital. I mean, without meaning to sound dramatic, literally dying of AIDS. And what it taught me was that there is always the possibility of love. That however bad things look like, there's always hope and there's always love. And at the end of it, the treatment for the PCP worked. I went back onto the chemo, that came better, I got better, and that now was, 27 years ago. And I've had 27 years more life and love that I didn't expect after that. And so, yeah, that was the greatest gift, was recognizing that for as bad as things are, there is always hope and there's always the potential for love.
It's wonderful. Wonderful. I'm tearing up.
What is one experience you wish you never had in your line of work, and why?
Oh. Goodness, where do you start? I mean, the thing that comes to mind first is dealing with a death of somebody very young who shouldn't have died, who was 27, who had navigated living with HIV from the moment she was born, with some really significant medical problems that were the consequence of advanced HIV when she was a child, but had done so well, and at the age of 27 died at home. And we won't ever really know why. And I guess it was, to me, a real kind of reminder that despite all the progress, actually sometimes things still did go tits up, for want of a better description. And being at that funeral and hearing the experiences, but also still that sense of that not everyone knew she was living with HIV, she hadn't told lots of people in her life, and it was almost like a history lesson, but I don't know, more recently. So that was, and there's always that sense that if, I don't know what happened to her, but if one of us had picked up the phone on that day, you just can't help but wonder. So that feels like something that just no one should die at 27. And so that I still think about her a lot.
Mm.
What about you?
Similar in a way. I have a very close friend and who I've known for, 40 odd years now. He was diagnosed very late at the end of the 90s. And at some point he mentioned that his partner hadn't been tested. And I'm like, well, really, you should get tested, shouldn't you? So I didn't push it, obviously, it wasn't appropriate to, but we had the conversation. And in the late 2000s, his partner was diagnosed with liver cancer. He had very late stage HIV and died before they could save him, went into sepsis, a whole bunch of different things. And I went to his funeral and they did not mention the word, they didn't mention HIV, the family didn't want anything said. And I was furious. I was furious at myself for not having had the conversation with his partner, but we weren't close, or for having pushed him to try and get him tested earlier. Clearly they both had HIV for 20 odd years and just not ever tested. But the fact that my friend nearly died and he still refused to test, it wasn't my line of work. But in the same way that we talked about integrity and justice, it's about HIV and it's about awareness and it's about having those conversations. And so my work doesn't stop with me leaving the office. HIV doesn't suddenly, just go back in the pill drawer once I've taken my pill. It's there, and I kind of have a sense of responsibility to my community, which is humanity. You know what I mean?
No, it's true.
So
it's true.
So that's I think that's the one for me.
Imagine all the people who have tested because of you.
And likewise. What would you say to a physician who says they don't have time to talk to their patients about what's happening outside the examination room?
I would say get another job. I would say that you are not just there to manage a condition. If that was the case, imagine in HIV medicine, we just leave the prescriptions, say your results are normal, see you in 6 months' time. Because it's about supporting someone to live with a condition. So I'd make sure they weren't joking, because I don't think there's any physician that I've met that would actually say that and mean it. And then I'd force them to sit down and speak to somebody. I'd get them to speak to you, Garry, because maybe the people they see don't have the confidence, the agency, the eloquence to say that to them. And I'd get you to explain to them why it's important that they ask about more than just what's within that consultation room. What would you say to a person living with HIV who says they are afraid to ask their healthcare provider about what they want and need?
The thing that I've been saying to them for the last 30 years, one thing like that. I guess it's the fact that people still buy into that power dynamic of a doctor. I can't say those things. I can't be, I can't be somebody that isn't perfect for my doctor. It's like, no, the whole point to be here is to talk about the challenges, the difficulties. And that is exactly why they're here, to be able to help, to want to make a difference when people are having difficulties. It's about saying, the person in front of you is a person. Yes, they've got a medical degree. That doesn't make them less human.
No.
If I met you years ago, before you started working in HIV, and compared you to who you are now, what is the biggest difference I would notice?
Medicine's a really intimidating place to work. I never felt comfortable in sort of general medical acute environments. I was just anxious. And now I feel confident, I feel comfortable in a specialty that I love, and in a specialty that feels shared decision-making, honest conversations, and going on a journey together. I think it's So I think I'm happy, and I moan, but I am happy. Yeah. What do you wish people understood more about HIV and why?
Let's just stick with U equals U.
Yeah.
If everybody on this planet understood that because I'm on effective medication, that my virus is reduced to undetectable levels, which means that it cannot be passed on, that undetectable equals untransmittable, that for me, I think would be the biggest potential to change people's fears and judgments. It's the thing that I talk about most often in relation to stigma and in relation to that old-fashioned mindset about HIV and the thoughts about AIDS, is that that's not what we're talking about today. So, yeah, undetectable viral load would be the thing that I think is the bottom line around changing stuff. And in my interactions through providing support over all of the years that I have, I think what I hear most often is the lack of appreciation from patients, that they feel that their doctors don't appreciate what a psychological burden it has on them. And therefore, whether that's about their wish to change treatment because of side effects or because of facilitating an easier option or a longer term option, that they don't feel heard or understood, and that how important it is to them, they're not able to speak that truth, or they're not given the space to do it. That's why my work is to support people to go and call the doctor out and you know, advocate for themselves more strongly, to make their voices heard. What have you learned from this conversation that surprised you most, and why?
I think hearing about, although I see your medical records and what you've described about having had PCP and the KS is there, it's just in black and white in a medical record. And I don't think we've ever, or I've never heard you talk about it in terms of what it was like to live through it and how vulnerable you felt. And I guess for me, it comes back to one of the questions we discussed earlier about a clinician who says they don't need to worry about what goes on outside, even though that's something from many years ago that is no longer a current issue. It still clearly had such a massive impact on you. So I think humanizing a medical history is invaluable. If this were to be our last conversation, we're going on a positive note. If this would be our last conversation, what is one thing you'd never want me to forget?
How much you matter.
We can't do something like that.
No, you need to know if you didn't realize. Personally, professionally, in HIV, in London, in the UK, in the world, you were there. So that thing about me being at that point, you were there already. You really make a difference on a daily basis.
Thank you.
And it's a privilege and an honor.
Straight back at you. Thank you. Goodness me. Can we never do that again?